patient presents with orchitis, scleritis, and insulitis. What's your diagnosis?
It could be a case of tuberculosis or maybe even sarcoidosis.
I think it might be related to an autoimmune disorder like lupus.
Perhaps it's a rare genetic condition like Marfan syndrome.
I'm leaning towards a metabolic disorder such as Wilson's disease.
No, no, and no. It's hereditary multiple exostoses. We need to perform rhizotomy immediately.
But rhizotomy is a risky procedure. Are you sure that's the right call, Hawks?
Damn it, Gary. I didn't spend years studying medicine to have my expertise questioned. We're going ahead with the rhizotomy, and that's final. Prepare the patient for surgery. All of you. Tracy, I really believe that we should perform rhizotomy on this patient of mine with hereditary multiple exostoses.
Hawks, I understand your recommendation, but I have to question whether it's the best course of action.
Questioning my years of experience, Tracy. I cannot believe this.
I'm not questioning your experience, Hawks. I'm just reminding you of your track record.
My track record. You know that I have always put my patients first and made the best decisions for them?
I know that, but we can't ignore the times when you were wrong.
Those were isolated incidents, Tracy. This is different.
Just be careful, Hawks. We don't want to make a wrong move with this patient's life at stake.
Leslie, this is not good. The patient is in critical condition. We need to act fast.
I know, Frank. Let's focus on stabilizing the patient first. We can worry about how to break the news to Hawks later.
But we need to tell Hawks that the rhizotomy was not the right treatment for hereditary multiple exostoses. He needs to know what went wrong.
I understand, Frank, and we will inform Hawks, but right now our priority is saving the patient's life. Let's stay focused on that.
What the hell were you all thinking? You nearly killed the patient with your incompetence. Wrong rhizotomy, wrong diagnosis. Are you even qualified to be diagnosticians?
But, Dr. Hawks, we followed our best judgment based on the information we had at the time.
I still think we were on the right track with the diagnosis, just executed it poorly.
I agree with Leslie. We just need to refine our approach next time.
Maybe we should have consulted with you before proceeding, Dr. Hawks.
Consult with me. You should have consulted with anyone with a pulse before making those decisions. You're all a disgrace to this hospital. Figure out what went wrong. Fix it. Or find a new line of work. I can't believe I have to work with such a bunch of amateurs. So, Johnson, how's everything going outside of the hospital? Any exciting plans for the weekend?
Oh, just the usual. Taking the kids to their soccer games, catching up on some reading. What about you, Hawks? Any big plans?
Actually, I've been really engrossed in this case. It's quite puzzling, but I think I'm getting closer to figuring it out.
That's great, Hawks. You always do have a knack for solving those medical mysteries. You're like a real-life Dr. House.
Suddenly realizing, wait a minute. I need to go. Thanks for the chat.
Confused. Okay. See you later, Hawks.
Sorry I'm late, guys. What's the situation here?
Hawks, why aren't you wearing protective gear? You can't just barge in here like that.
Seriously, it's basic protocol. You're putting everyone at risk.
Listen to me. Hereditary multiple exostoses was a misdiagnosis.
Kennel cough. Are you sure? What's the prognosis?
Kennel cough. Highly contagious, but typical recovery in 1-2 weeks with proper treatment.
That's a bold claim, Hawks. Are you sure about this diagnosis?
Absolutely sure. The signs and symptoms match perfectly. Trust me on this one, folks.
We should proceed with caution, but Hawks may be onto something here. Let's prepare for treatment.
All right, let's follow Hawks' lead. We need to contain this before it spreads any further.
Tracy, I finally got to the bottom of the patient's symptoms. It was a challenging case, but I nailed the diagnosis in the end.
That's great news, Hawks. I'm glad you followed through and stuck with it.
Yeah, well, maybe if I didn't have to deal with such incompetent doctors around here, we wouldn't have wasted so much time on the wrong diagnosis.
Hold on a second, Hawks. You were the one who initially diagnosed the patient incorrectly. Let's not shift blame here.
Well, my team could have pointed out the red flags sooner. They should have caught my mistake.
Hawks, you can't just pass the blame on to others. Take responsibility for your own actions.
Stands up abruptly. I don't have time for this.
I've got real work to do. Leaves the office.